Hello, everyone. Today, we are excited to bring you the highlights from ESMO 2024, focusing on GI malignancies. I'm Rohit Gosain, and I'm here with my brother and co-host, Rahul Gosain. Out of thousands of abstracts presented at this Congress, ESMO 2024, we have selected four key studies with significant implications for our practice and community today. To guide us through and make sense of this data, we are thrilled to have Dr. Kristen Siember, a GI medical oncologist from Vanderbilt University. Kristen, thanks so much for joining us today.
Thanks for having me.
Kristen, welcome. Over the next 20 minutes, we'll focus on four abstracts, starting off with the recent update of LEAP-012 in HCC. Then we'll discuss Keynote-811, showing updated overall survival data in GE junction and gastric cancer. We'll switch gears to podium studies showing overall survival benefit in anal cancer. And then finally, we'll touch on NICHE-2 study, a success story for our MSI-high patients. Okay, so let's take a dive into this. Starting off with LEAP-012. Kristen, can you walk us through the study design and its findings here?
Sure. So LEAP-012 is a study for patients with HCC. Now, as with most HCC studies, they did have to have Child-Pugh A disease, which is a little bit tough for some of our patients to qualify for, but it was for good reason. Patients had to have lesions that were treatable with TACE in either 1 or 2 sessions. They could not have had extrahepatic disease and no portal vein thrombosis. So patients who were enrolled were randomized in 1-to-1 fashion to Lenvatinib, Pembrolizumab plus TACE versus placebo, double placebo plus TACE, with the primary endpoints that they were looking for were both PFS and overall survival. So what we saw here was an interesting improvement in PFS with a hazard ratio of 0.66 in favor of the Lenvatinib Pembrolizumab plus TACE arm versus dual placebo plus TACE. So this was the median PFS difference was about 4.5 months, which was fairly significant with good separation of the curves. The overall survival data is still immature, so we have to wait a little bit longer to get more information from that, which is really why I think we need to be cautious before we make any firm conclusions on the data.
Thank you, Kristen. Kristen, I have a few things to reiterate here. As you stated, this was rather a Child-Pugh A population, which we would like to see in our clinic, but unfortunately that is not the case for this particular tumor type. And from liver-directed therapy standpoint, we did a podcast and discussion with IRs and RADOLs a few months ago, and what was concluded was that SBRT over TACE is a better modality. So seeing if that translates into this, though this was only with TACE here. Also, LEAP-002, which was Pembro with Lenvatinib and first-line HCC, was in fact a negative study. Well, as we see that PFS is better, but we'll have to, as you said, OS is what is going to determine if this is going to replace the standard of care option here.